Welcome to Speak Up and Stay Alive RadiOh with author, speaker, and your host, Pat Rouleau. Serving you a generous helping of everything you need to know to help you and your loved ones stay safe during any doctor or hospital visit. The program is not intended to replace medical advice from a licensed professional, but rather to encourage you to become a well-informed participant in your health and well-being. And now, your host, Pat Rouleau.
It takes a lot to wake up the average person. People who are awake now and wanting to do the right thing, but there's a lot of vested interest in making money off of making a greater neurotoxic environment. Until consciousness raises to a high enough level, we see that's just unacceptable.
Hello, I'm Pat Rouleau, and welcome to Speak Up and Stay Alive, Patient Safety Radio, possibly the only show on the planet that tells it like it is when it comes to keeping you safe during every healthcare and hospital encounter. You just heard a snippet from today's returning guest, Dr. Brant Cortright, author of the book, The Neurogenesis Diet and Lifestyle, and he's back again today to talk about 4 poisons that affect our brain. So stay tuned for that. This week, I oddly received several different emails from folks with the recurring theme of misdiagnosis. So I'm going to revisit that in just a moment. Speaking of moments, take a quick moment and get comfy. Prop up your feet, unless of course you are driving. Turn off that darn cell phone that does nothing for your health and fries your brain like a potato chip, and enjoy our time together. Because right now, we're heading in to the healthcare hazard of the week. So doctor, I have what? Wait, can you repeat that? How is that spelled? Wait, I can't understand what you're saying. Well, don't get upset. I just don't know what those words mean. Can you slow down, please? I still don't understand. I have more questions, please. Can you stop typing into your computer and look at me? So what's the treatment? Did you say 3 times a day? Please hear me. I don't understand. Considered a medical error, a misdiagnosis can occur by diagnosing the patient with the wrong condition, failing to diagnose anything at all, or delaying diagnosis and allowing complications to develop. A diagnosis is an educated guess. Doctors derive this guess by reviewing the set of symptoms and any test results. Although test results are an important diagnostic tool, they are not without hazard. Not only can a test be performed incorrectly, but the results can be interpreted incorrectly too. Many times the test results are inconclusive, so now interpretation and supposition comes into play, and it all becomes more vague when drugs, procedures, and surgeries are thrown into the mix in an attempt to determine the problem. Each test, treatment, and intervention comes with its own potential for error. The more tests you have, the greater margin there is for a mistake. Meanwhile, you may not get the treatment for the condition you do have, or be subjected to risky treatments for problems that you do not have. It's a fact. Misdiagnosis rates in the intensive care unit have been studied, with rates ranging up to 40%. In fact, reports show that nearly 1 in 6 people have been misdiagnosed at some point in their medical history, and that is scary stuff. Another way to think about hospital misdiagnosis is to remember the law of the instrument. When you talk to a surgeon, the problem and solution will most likely involve a surgery. Say you talk to a holistic practitioner, and he or she might point to therapies, herbs, and lifestyle changes. So it's very important to get several opinions from reputable sources before deciding upon a form of action that might only speak to the preference or the inclination of the person making that recommendation. So how does a misdiagnosis happen? Well, it can happen if a doctor fails to take your complaint seriously or fails to notice or understand the nature of your symptoms. It can happen if a doctor fails to refer you to a specialist for further testing or treatment, or by ordering the wrong test, misunderstanding the test results, or misreading lab reports. Poor x-rays and other imaging errors can also cause a misdiagnosis. How about the lack of focus, fatigue, a rushed and harried behavior on part of the doctor? That can certainly contribute to a wrong diagnosis. Or how about we, as the patient? We can be a problem when we don't share everything with our provider. We have to be accountable too, you know. The only way to get an accurate diagnosis is by sharing accurate information, even though it is sometimes embarrassing to discuss sensitive symptoms. Well, here's a few things to look for to avoid a misdiagnosis. Number 1, look for test results that don't match with the diagnosis. So if your test results have little to do with the diagnosis, then question the validity of the test and question the diagnosis. This could be a red flag that one of the two isn't right. Number 2, look for treatment that does not work as expected. It may not be working because it's not a match for the true diagnosis. Either the treatment is wrong, or perhaps the diagnosis is wrong. It's definitely a starting point. I remember my gut feeling of a misdiagnosis when my doctor prescribed an antibiotic for a throat symptom I was having, and despite taking the entire course, my symptoms didn't improve. Turns out I didn't have what he thought I had. Therefore, the drugs were useless and therefore dangerous to my health. Number 3, if the doctor is short with his or her time, or if he or she is vague, demand answers until you are satisfied, or change doctors. Number 4, always look for a second or third opinion if the first diagnosis or treatment option seems drastic. And number 5, to avoid a misdiagnosis, think about your gut feelings. You know when something's not right, and that's something worth remembering. I did this. I remember when my mom was in the hospital, about, I'd say 2 months into it, they diagnosed her as being depressed. Hello, been on life support for 8 weeks, kind of depressing. So they gave her a high doses of antidepressants and anti-anxiety drugs until she began to see bugs on the wall and babies on the tray table. Well, my gut reaction was wrong diagnosis and medication side effects. So pay attention to your gut feeling. Well, here's some additional questions to ask your doctor about your diagnosis. First, ask, how sure are you of the diagnosis? Ask, what else could it be? Is there anyone else with whom we should consult? It's especially important to question all radiology reports. Here's a question to ask. Are the images and biopsies clear enough to be read and interpreted with accuracy? Did your doctor speak directly to the radiologist or technician who read and interpreted the report? Or is the doctor merely reading a copy of the report? Did the images rule out the problem? Or did the images simply fail to show the problem? So these are some things to look for, and be sure to keep track of all radiation exams. And here's a tip that frightens people. Be proactive when it comes to finding out your test results. Don't assume that no news is good news. You have every right to request and receive information about your test results. And then once you've received the verbal results, ask for a printed copy for your file. Remember, this is not being a pain in the butt or trying to push or hurry someone. This is you managing your health and your life. What else could be more important? Your doctor has not seen everything. Usually, doctors see about 300 different diagnoses throughout the course of their practice. This leaves a lot of room for error. So when your doctor announces your diagnosis, always ask, what else could it be? And to reduce the chance of receiving a misdiagnosis, bring someone, a trusted friend or a family member with you to the doctor's office to help you take notes. Your health is not the time to worry about hard feelings. Any worthwhile doctor should encourage you to understand your diagnosis. So what's the treatment? Did you say 3 times a day? Please hear me. I don't understand. And with that, let's hear some legal news you can use. You've heard me talk about my attorney friends at Schrapp & King, and I know many of you have taken my advice and contacted them to help you with your advanced directives. Things like a healthcare power of attorney, living will, help with information about the Do Not Resuscitate form, and more. But today I want to share with you something that really underscores just why I suggest that you work with the folks at Schraff & King and why they are on this program. Schraff & King are one of only a few practices within the state of Ohio that actually have a certified elder law attorney within their group. Attorneys certified in elder law offer you something that other attorneys do not. So don't go anywhere else. Contact the folks at Schraff & King today. 440-585-1600. That's 440-585-1600. Or visit them online at schraffking.com. And be sure to let them know that you heard about them here on Speak Up and Stay Alive. Again, it's 440-585-1600. 440-585-1600. Call them today. After the show, be sure to visit the website, speakupandstayalive.com, for more life-saving information. Plus, that's where you can purchase the book, Speak Up and Stay Alive, The Patient Advocate Hospital Survival Guide. Bring the book to the hospital with you. It's the best way to stand out, and in a positive way. And remember, we donate 2 handmade pillowcases to either a troop member or to a local veterans shelter for every book sold, with your name on it as the donor. So for a mere $20, you benefit, and so does some well-deserving warrior. Give a meaningful and useful gift that really says, I care. Give the gift of healthcare safety. Purchase the book, the patient safety logs, and throw in some of those icebreaker cards. It's a one-size-fits-all present that everybody needs. You can order online at speakupandstayalive.com, or you can request by email at speakupandstayalive.com, or call me 440-725-5462. You are listening to Speak Up and Stay Alive, Patient Safety Radio, and I am your hostess, Pat Rouleau, always looking for ways to keep you and me in tip-top shape in order to avoid a healthcare or hospital encounter. And I can't think of a better way to do that than to start with our brains, because after all, it all begins up there. Now, if you tuned in last week, you'll remember that we talked about neurogenesis, the process of growing new brain cells, and we busted several myths and came to understand that contrary to popular belief, the brain keeps growing new brain cells your entire life. This process of neurogenesis is how the brain upgrades itself and enhances your quality of life. And we also talked about foods to eat to improve neurogenesis, along with other lifestyle choices. And you can hear that entire segment again by going to the website speakupandstayalive.com, where we've posted that interview. Well, today we're going to find out how to increase neurogenesis by not slowing it down. And apparently there are 4 poisons that can get in the way: chronic inflammation, chronic stress, physical assaults, and deprivation. And with me to explain this and add light to this very interesting and important subject is today's guest, Dr. Brant Cortright, a clinical psychologist and professor of psychology at the California Institute of Integral Studies. His consulting practice specializes in cutting-edge brain health and neuroscience-informed depth therapy. He is the author of several books, and we are going to discuss his newest book today, The Neurogenesis Diet and Lifestyle, Upgrade Your Brain, Upgrade Your Life. And we are about to upgrade our life right now by welcoming you back to the show once again, Brant. Thanks for being here.
It's really good to be here. Thank you.
Thank you. So I want to dig right in today with this topic. What is chronic inflammation, and why is that a problem for our brains, and what can we do about it?
So, yes, we've been talking about wanting to increase our rate of neurogenesis, and therefore our cognitive capacities, increasing our emotional resilience. And we want to do that by increasing activities and foods that stimulate neurogenesis and avoiding activities and foods that decrease neurogenesis. And so one of the most toxic things in the brain is the immune system itself when it goes awry. And by going awry, what I simply mean is that inflammation, which is a healthy process to get rid of an infection, when it becomes chronic and this inflammatory cascade goes throughout all systems of the body and into the brain, it's extremely damaging to neurons. And it begins to really chew up the inside of our blood vessels, chronic inflammation, it's known as the silent killer because we often aren't aware of it. Chronic inflammation is one of the most neurotoxic things we can expose our brain to. Not only do neurogenesis rates plummet when the brain is inflamed, it actually is neurotoxic to the cells. And the brain gets 20% of the body's blood. And so what is generally healthy for the heart and the cardiovascular system is generally healthy for the brain as well. And similarly, what hurts the cardiovascular system hurts the brain. So chronic inflammation scars the inside of our blood vessels. And these scars, sort of like potholes in the road, get covered over with foam cells and plaque. And as that happens over and over again, our arteries get harder and harder, smaller and smaller, and we become vulnerable to heart attacks, strokes, and it is toxic to the brain and slows down neurogenesis.
How would the average person know if their body and their brain was inflamed? How would we know that? And then,
good question.
Yeah, and then
there's
what?
A few blood tests.
Oh, okay.
Whenever you have your next physical, they're worth making a part of it.
Okay.
One is the high sensitivity C-Reactive protein.
Okay.
High sensitivity CRP. And that is a general inflammatory marker. If you have high levels of inflammation, the sooner you know it, the better, because then you can begin an anti-inflammatory process, both of diet, of exercise, and other things. Another thing is homocysteine. Homocysteine levels also are indicative of a level of inflammation in the brain. Those two things in particular would be worth looking at.
Okay, so you said high sensitivity C as in cat, CRP, that's one test, and the homocysteine levels. So those are two things.
Homocysteine.
Homocysteine?
Right.
Okay, homocysteine. Those are two things we could bring up to our doctor and say, hey, we would like to have that included with our blood panel. Is that correct?
Yes, exactly right.
Okay, all right. And now, what can we do about that? Well, let's say we have high levels. Is it strictly diet, or what are our alternatives to lower the inflammation?
I mean, we need to see what is the cause of the inflammation. Mm-hmm. And sometimes it's just general dietary lifestyle factors. As we get older, we have higher and higher levels of inflammation in the brain, which we don't want because they age us so rapidly. What we want to do is to eat nutrients that are anti-inflammatory. So inflammatory foods are things like fried foods, cooking at high heat, cooking with vegetable oils. High sugar is also a high inflammatory diet. So there are certain things like turmeric, for example, which are anti-inflammatory, antioxidant, and they begin to extinguish the fires of inflammation. Turmeric, which is the spice in curry spice, you can take it as a capsule, or good to do it micronized, so very, very small particles. Another good thing is green tea. Green tea is an anti-inflammatory, an antioxidant. It also increases the rate of neurogenesis. So what we want is the equivalent of 10 to 15 cups of green tea a day.
Wow.
However, we don't want that much caffeine. Caffeine in general is not great for the brain. It constricts our blood vessels in the brain. We want more blood into the brain, not less generally. There are actually supplements where they do green tea extracts, where with a capsule you can do the equivalent of 10 to 15 cups of green tea that are caffeine-free. And also blueberries. Blueberries are hugely helpful. They are anti-inflammatory, antioxidant, and almost like Miracle-Gro for the brain.
Excellent.
The brain just explodes in new neurons with blueberries. And you can do blueberries, either straight blueberries, or you can do them as an extract. You can do them as capsules.
Okay.
And then the last thing is omega-3 fatty acids. Mm-hmm. Omega-3s are very anti-inflammatory.
All right. This is Good to know. Now, you also do coaching and counseling. So if folks really are interested in this and wanted some kind of a one-on-one conversation with you, you do that as well, yes?
I do, yes. You can just go to my website, brantcortright.com.
Okay, brantcortright.com. Excellent. All right, our next poison is stress, and we mentioned that briefly on our last program, that there's good stress and bad stress, but let's talk briefly about the differences.
Yeah, good stress brings forth new capacities. Good stress is when we're challenged in a way that is time-limited, so it doesn't go on and on. A really huge traumatic event, it looks like, can actually shrink the brain. And so can chronic stress. Chronic stress definitely can shrink the brain. No stress, just a life of comfort, leads to rapid deterioration. Too much stress, and it's bad for the brain. Too little stress, and it's bad for the brain. So it's one of these Goldilocks problems. Just the right amount of stress for us.
And we kind of touched on this the last time, but I just noticed that society seems to be more stressed as more people are, feeling that they have to be connected. Everybody's always fiddling with their phones, they're online, and Facebook and Twitter, and there's none of that downtime or alone time or introspective time. And when I look out into the world, it seems people are more stressful because they feel that they need to be so connected.
I think that that's a huge part of the stress that as a society we are feeling. And a huge part of the stress that adolescents are feeling.
Yes, especially young people, yeah.
Most adolescents now say they feel too stressed. Something like 30% to 40% of millennials now say they can't sleep well at night because of stress. Constantly being online is itself a form of stress. You need to be able to get offline. You need to be able to disconnect and just be with your physical environment, and not always waiting for the dopamine rush of the latest text or the latest email or whatever it is. But being constantly connected, it does something to our nervous system. Always being plugged in and online, you're absolutely right. It begins to be detrimental to the brain and to the process of neurogenesis.
Now, the third poison you talk about is physical assaults, and we're not talking about falling off a bicycle and hitting our heads, all that could be a physical assault, or being hit by a baseball, but more common than that are the assaults in the form of chemicals and the toxins in our living environment. So let's give us some examples of that.
Yeah, well, the big one is mercury. There's this incredible YouTube video that I saw recently that showed how just a few molecules of mercury cause neurons to just curdle up and implode. Mercury is an extraordinarily powerful neurotoxin. Not only is there too much mercury in our environment and our fish, but there's a lot of other neurotoxins out there like that have never been really checked to see what their effect is, or only minimally checked. And this toxic load begins to have an effect on the brain. It begins to slow down the rate at which we can really repair and renew ourselves. Lead is another example. There's less of it in our environment now, but there's still way too much of it. Glyphosate, the pesticide used in Roundup with genetically modified foods. It's not at all clear what effect this is going to have on the brain. There's some people who are saying that the glyphosate, it kills the bacteria in our gut that is responsible for making some of the good neurotransmitters that our brain needs. And that there is this side effect that hasn't been talked about much, but is starting to be investigated, where you get lower brain function because you have fewer microbes in your human biome, in your intestinal tract. There are just so many pollutants out there that we want to eat food that is as pure as possible.
As you're talking, I'm taking rapid notes, and you were talking about we need to eat foods as pure as possible, and you mentioned the genetically modified foods, and we've talked on the show about the Monsanto seeds that are aluminum resistant. And why would that be? And perhaps there's that connection with the chemtrailing that's going on, that we're being sprayed from the sky, aluminum and barium and strontium. So now we've got seeds that are resistant to aluminum that's being sprayed. And how can we eat pure if our foods and the soil that our food is growing on is covered with these toxic chemicals that are being sprayed? So have you done much with the thought of chemtrailing?
I confess I don't know anything about it.
Okay.
It's a brand new one for me.
All right, well.
But I know that aluminum also is another big neurotoxin, and it's implicated in Alzheimer's. There's some studies to show maybe it's okay, but there's a lot of studies that show it's not okay in terms of Alzheimer's. And there's aluminum in our vaccines.
Yes.
There's aluminum everywhere, and that's another thing we want to try to not get into our bodies if possible.
Right. Well, yeah, I hope that you take a peek at chemtrails, because what's being sprayed on us is highly dangerous and toxic to our soil, and it's basically killing us, I would imagine, when our bodies are not meant and our brains are not meant to absorb those type of heavy chemicals and those heavy metals. When you mentioned mercury, I also wrote down the Cfl light bulbs, because they do contain mercury. And I just did a segment a few weeks ago, kind of cutely called Death by Light Bulb. And I shared the explicit EPA guidelines for cleanup should one of these bulbs break in your home, because I would think that the natural instinct would be to vacuum, yet the guidelines from the EPA clearly state that doing so will cause the mercury vapors to spread through the air. And so I seriously have to question why we're being forced to give up the safe incandescent light bulbs for these unmistakable health hazards. And I was very curious to know your thoughts on that.
Anything that brings more mercury into our environment seems like a bad idea to me.
Yeah.
And there's also just the question of the light waves also, that we want as full a spectrum as possible, and that some of these new light bulbs have very limited light wave frequencies, and so are unhelpful that way as well. But I think you're right. It should be much better publicized how to dispose of these things if they break.
Well, yeah, I went to the store, purposely picked up a package, and it says contains mercury. Well, the average person doesn't really know what that means, and it says see the EPA guidelines for cleanup. Well, there's a lot of older people that don't even go online, and where are they going to find these EPA guidelines? And secondly, you break a light bulb, you just start swishing it around, and you're not going to head to the EPA website, which has this giant page on how to clean up properly. So now here we have the mercury spread within our home and also in our landfills and our general environments. Pretty scary.
Yeah, that's right.
Yeah.
And vaccines are finally out of children's vaccines now, but they're in a lot of adult vaccines and in amalgam fillings.
Yes, mercury fillings. Yep, we've done shows on that as well, and so that if people want to have their mercury fillings removed, you need to go to a certified dentist that knows how to do that. They dress in hazmat suits when they're doing that.
Right. Yeah.
Yeah. Wow. Now at the end of every chapter in your book, you have a short paragraph or two that's the heading is called Future Dreams, and I put a star next to this statement. One of the dreams for the future would be that environmental awareness is high and that no one will even try to lobby Congress for higher mercury or lead levels because any corporation would be too ashamed to try to make money at the expense of children's growing brains. And I do think that is a dream. It's probably a fantasy. And I think we're actually living in a nightmare sometimes where we've got corporations and governments that really do anything to make a buck at anyone's expense. There really is no shame. And I think about the Wi-Fi in schools that's assaulting children by bathing their brains in a sea of radiation. And we just mentioned the Cfl light bulb is certainly proof that no one cares. They call it smarter energy savings, and there you kind of have the candy coating that the average consumer craves. And so I compliment you on your future dreams, but I just don't see that happening until we're actually counting bodies in the street. And I want to know what your thoughts are on that.
Well, you may be right on that. I actually feel quite optimistic over the long run.
Okay.
But over the short run, I don't feel so optimistic. I think things are going to get worse, maybe much worse, before they get better. It takes a lot to wake up the average person.
It does.
There's many people who are awake now and wanting to do the right thing, but there's a lot of vested interest in making money off of making a greater neurotoxic environment and polluting. And it's until consciousness raises to a high enough level, we see that's just unacceptable. It's hard to imagine that changing.
Yeah.
But I assume we will get there, and I'm hopeful.
All right, I'll be on your side. How's that? Okay, now your fourth and final poison is deprivation. What do you mean by that?
Yeah, that the brain needs stimulation. We need optimal engagement. And so when the brain is not stimulated, neurogenesis goes way down, anxiety rates go up, and depression rates go way, way up. Think of a person in an old folks' home who is confined to bed, or think of somebody in solitary confinement, or think of people just in environments that are very poor in terms of sensory stimulation. It's not good for the brain. The brain wants to engage with the world. And so to the extent that we are isolated from social contact and from sensory stimulation, it's bad for the brain. So it turns out that social isolation creates a huge risk for both depression and heart disease. And it also slows down our rate of neurogenesis. Social isolation, which something like over a third of seniors experience in this country,
right,
is very damaging to the brain. It increases blood pressure, increases cardiovascular disease, increases depression. It's a greater health hazard than smoking is. Again, so it's like each brain needs to kind of figure out our own optimal way of engaging the world.
Right. Wow. So much to know about this brain of ours.
It is.
It really is. Now, as we start to wrap up, is there anything else that you'd like to talk about today that we've missed on our two conversations about neurogenesis?
Well, I guess I would just want to emphasize again the importance of a holistic approach, meaning body, heart, mind, and spirit. That doing any one thing may increase neurogenesis along a particular line, but it's doing all these things together that keeps our rates of neurogenesis high. So to keep about 100% or close to 100% of the new brain cells actually alive, we need this body, heart, mind, spirit stimulation. And I guess the last thing I just want to underline is that we can all increase our rate of neurogenesis. And that almost all of us are operating below where we need to. We can be operating at a much higher level if we just begin a neurohealthy lifestyle that is increasing our rate of neurogenesis.
And we can find all of that at your website, so why don't you share the contact information and where folks can purchase your book?
Okay, good. You can get it at Amazon or any bookstore can order it. And through my website, it's brantcortright.com. And there's also a book website where you can read the first chapter for free if you're interested, and that is Neurogenesisdiet.com.
Okay, Neurogenesisdiet.com or BrantCortright.com.
That's right.
Excellent. Well, now I'm going to end by quoting a statement from your book. You say, the theme of this book is that to increase neurogenesis, your whole being, body, heart, mind, spirit, needs to be aligned with your brain's project of bringing forth its potential. Your brain renews itself by engaging with the world through developing your skills, talents, physical abilities, your emotional powers for connection, love, empathy, and by using your mind and awakening your spirit. And with that, I encourage everyone to get a copy of this highly informative and important book, The Neurogenesis Diet and Lifestyle by Brant Cortright. Brant, what a special treat to meet you, and I thank you personally for increasing my neurogenesis. I know that I have more brain cells for having met you, and especially after reading your book, and I thank you so much for taking the time to share with us today.
Well, it's been a pleasure to be here. Thank you for having me.
It's summer, and that can only mean one thing. It's time to have some fun with your friends, your family, and there's only one place to do that: Pioneer Waterland and Dry Fun Park, 10661 Kyle Road in Chardon, Ohio, 440-285-0910, or visit the website pioneerwaterland.com. See you there. You are listening to Speak Up and Stay Alive, Patient Safety Radio. Now you can join us every Saturday morning in Cleveland, Ohio, or listen to us live online from anywhere in the world at the station's websites. I am your hostess, Pat Rouleau, so happy to spend this hour with you to help you survive any healthcare or hospital encounter. And remember, if you like what you hear on this radio show, I speak live and in person too. In fact, we're even better in person. Our presentations are fast-paced, interactive, and chock full of immediately usable patient safety tips and tools. I can guarantee that your crowd will love it. No one's thrown food at us yet, have they, Bob?
You got it.
All right. So email or call us about speaking to your business, your club, church, or hospital. I speak both to the patient perspective or the provider. Email us at speakupandstayalive.com or call me directly at 440-725-5462. You and your audience will be glad that you did.
Shocking news from around the world.
Well, today, the boys decided to play one of our newest games, Shocking News from Around the World, and our guest, Pam, she kindly agreed to play the game with us. Thanks for indulging us, Pam.
Oh, thank you. Okay.
All right.
I'm ready.
Goody. Our games are always a fun and fast way to share serious information. So here's how it goes. I will read a recent bit of shocking news, and you will use your keen sense of reasoning to determine if the statement is right, and that would be a shock, or is it wrong, and that would be a crock. So, is the statement a shock?
Wow.
Or is it a crock?
Oh. Oh.
Silly.
Okay.
All right, here we go. The Speak Up and Stay Alive shocking news number 1. Surgeons allegedly left 16 medical items in a body of a German cancer patient. Is that a shock or is it a crock?
Who wants to go
I
first?
say that certainly is a shock.
I think that's true. Okay.
I think so.
What do you
It
think?
could happen. We're finding out all the time what's left in somebody with surgery.
We are. What do you think, Joe?
I think it's a shock, but I don't think it was a German. I think it was a Frenchman.
Why?
Oh.
Oh, you don't want to go there.
Oh, my
What do you think,
gosh.
Bobby?
Well, personally, I know it's a shock because I heard it on the news, so I'm going to say that is definitely a shock.
You guys are right. It is a shock. Very
Okay.
good. It's true. A hospital in Germany is being sued for medical malpractice after surgeons allegedly left more than a dozen medical odds and ends inside a cancer patient's body during a 2009 operation. The man had undergone a routine surgery for prostate cancer. The operation was believed to have gone well and was told that he had at least another 6 years to live. However, post-surgery, the man discovered that his wounds had healed badly, and according to his family, the pain was so intense that he often could not sit. So when the surgeons operated on him again, they were stunned to find 16 pieces of medical equipment in his body, including a needle, a 6-inch roll of bandage, 6-inch long compress, several swabs, and a fragment of a surgical mask. And it took them 2 operations to remove it all. But here's the kicker. This is what I don't believe. This hospital claims that the instruments may have found their way into his body after the operation.
Oh, come on. Well, that is a shock, too.
That's a shock also, Pam.
That is
Right.
a shock. You know, we've been talking about disclosure, apology, and resolution. Can you imagine not just denying that that was an error, but then suggesting that these 16 items somehow mysteriously found their way into his body after the operation?
I don't think so.
I don't think so either. No.
I don't think the guy was eating needles, do you?
No.
All right. Here's a Speak Up and Stay Alive shocking news number 2. Hold your hand flat and look closely at the length of your fingers in relation to each other. Is your index finger shorter than your ring finger? They're saying that this is a test for osteoarthritis. Is that a shock or is that a crock?
Personally, I believe that's a crock.
That's a crock, but there is, I've heard once, I don't know if it's true about your heart condition, but I would say it's a crock.
Okay. What do you think, Joe?
I'm not sure which one's my index finger.
I'm pointing at you, Joe.
I'm just kidding.
I know you are.
Wait, so the index finger is shorter than the ring
Yeah,
finger?
if it's shorter than your ring finger, it's a good test for osteoarthritis.
Oh, well, I'm screwed.
Answer the question. Is it a shock or is it a crock?
It's a crock.
No, it isn't right.
No?
It's a shock.
Wow.
It's true. It's true.
It's true?
Here's what it is. A recent study at the University of Nottingham in England found specifically if a woman's index finger is shorter than her ring finger, she's more than twice as likely to develop osteoarthritis of the knee or hip. So,
Oh, dear. I got mine is shorter than my ring finger.
well,
So-
don't panic. Just be on the alert for signs of osteoarthritis, such as pain in your
Okay.
knee, hip, or
Mine's
shoulder.
shorter too, Pam.
Well, we don't know what it means for guys. Well, anyway, according to the article, women, don't worry. Just be on the lookout. Here's the advice for the guys. If you notice your girlfriend or your wife checking out her ring finger, distract her by buying her a drink.
Aw.
I don't know.
Okay, I will research that.
All right, let's research that.
Okay.
All right, you guys, the Speak Up and Stay Alive. Shocking news number 3. Scorpion venom could help treat brain cancer. Is that a shock or is it a crock? What do you guys think?
I think it's a shock.
Joe thinks
I
it's
think
a shock.
it's
What about you, Pam?
I think it's a shock.
Okay.
You know, I'm going to say shock.
All right. It is a shock. It's true.
Okay.
Wow.
Yes.
Well, we made it, guys.
You guys did it. It's called the Death Stalker scorpion. It's a specific scorpion. There's a peptide called chlorotoxin. It has been shown to be a potential for treating human brain tumors. And there's also been some evidence to show that other components in that venom may aid in the regulation of insulin and therefore could help with diabetes.
Oh, that's great.
But it's not the scorpion found in Arizona. It's an Israeli scorpion.
Well, maybe we need to go to Israel and find one.
Yes, you'll have to find one. Well,
I don't want to be looking for one. How's that? I want to be bit by a scorpion. All right, guys, the Speak Up and Stay Alive shocking news number 4. Eating a fatty meal before surgery boosts your chances of a fast recovery. Is that a shock or is it a crock?
it's a crock.
It's a crock. You're not supposed to eat it all, from what I understood.
What do you think, Bobby?
That's right.
I don't know because I hadn't had surgery at one time and I didn't eat then, so I wouldn't know. I'm going to say crock.
Yes, you guys are right. You're good. It is a crock. Although,
You're not supposed to eat a fatty meal that much of any time. So
absolutely. So,
That's the reason we eat
Okay.
fish, isn't it?
well,
that's right. That was fish that we had, which was delicious. So
it was delicious.
you have to come back and have it again.
We will. Anyway,
Uh-oh.
researchers suggest that a low-fat diet in humans before surgery may decrease the incidence and severity of complications that are brought on by inflammation. The trauma of surgery impacts the chemical balance of fat tissue. And in a study of mice, that when the mice consumed a typical Western diet of high-fat diet showed an exaggerated imbalance response. So I may be restricting food intake to a lower fat diet just prior to days of surgery actually might help reduce complications.
I
That
would think
sounds
that would be the
logical.
best thing to do.
That sounds logical.
Yep. Okay.
It does.
No more fried dill pickles. All right, the Speak Up and Stay Alive shocking news number 5. Sphenopalatine ganglion neuralgia
Okay, you're making it up right now.
happens when you eat ice cream or gulp something ice cold too quickly. Is that a shock or is it a crock?
Oh,
You have to say that again.
Yes, let's go over that again.
Okay.
What condition?
It's called sphenopalatine ganglion neuralgia. Happens when you eat ice cream or gulp something ice cold too quickly.
Is that brain freeze? Is that what you're trying to say?
Yeah,
Bob,
it's a shock.
Well,
That's
I'm
a
just going
shock.
to take a guess and say a shock.
it is
That's
a
a shock.
shock. And yes, Bob, you're
Okay.
right. It's better
Wow.
known as brain freeze.
How you like that one?
Bob, you're good.
Well, guess what, everyone? I made homemade peach ice cream and homemade pistachio ice cream today. So I will be very careful when I'm eating that I don't have that happen.
Well, you know what? If you made that homemade
Take
ice
small
cream, Pat's getting ready to make a homemade peach pie so we could put them together, Pam.
Ooh, that sounds great.
Oh my gosh, you guys. All right. Well, when you eat your ice cream, just don't gulp it. Actually, brain freeze is really a type of a headache that comes on fast and it's resolved as well. And I want to explain to you how it happens so you guys don't do it. When you slurp a really cold drink or eat ice cream too fast, you're rapidly changing the temperature in the back of your throat. And that's where the internal carotid artery, which feeds your brain, your eye, your forehead, and your nose, it meets the cerebral artery, which is where the brain tissue starts. And I guess the brain doesn't like for things to change, so it freezes to prevent you from doing that. So what do you think the cure would be?
Let it melt.
The cure?
Yeah.
Yes, I would say, and don't do it again. Just use regular tap water, not cold.
Exactly. Stop drinking it that fast. Actually, they say you could jam your tongue up to the back of your throat so that you could warm it up, or drink something warm to normalize the temperature.
Well, I guess also when you're out working in the heat, mowing or working, don't come in and try to get a glass of ice water. That's the worst thing you can do. You just want to use it regular tap temperature.
That's true. They say the ice water actually isn't really good for you. All right, so now you know what sphenopalatine ganglion neuralgia is. Let's not call it brain freeze anymore, guys. Let's get
brain
serious.
freeze. I have that most of the time. But I didn't know the condition. Now I'll know.
Now
okay.
you know.
All right.
Oh, you guys are crazy. And here's our final Speak Up and Stay Alive shocking news. Emails, phone calls, and comments, as well as other random research, suggests that you may get better service from your hospital providers when they see a copy of the book Speak Up and Stay Alive on your hospital tray table. Is that a shock, or is it a crock?
That's a shock.
That's definitely a shock.
And I think that's the best idea to ever have.
What do you think, Joe?
Well, I'm just going to say it's a shock, even though
Joe
you guys are
didn't
looking
take-
at me to say it's a crock so you can make fun of me.
Joe, you didn't take your book to the
you
hospital last time, did you?
No, but I made sure that they all washed their hands.
That's good.
Good.
If you're taking the book, you've got a little bit better results.
That's right. Because so many people have told me this, Joe. In fact, I have a copy of an email right here in front of me. And it says, Pat, I bought your book at our company's presentation. The next day I had emergency gallbladder surgery. I grabbed your book thinking I would have a chance to read it. I laid it on my tray table, and I tell you, everyone who came in asked about it. I think it definitely set me apart from the rest of the patients on the floor. I received the best service ever. They even washed their hands. And that's not the only time I've heard a comment of that type. So, folks, for $20, you can get better service, more hand washing, and your providers will know that you are an informed and empowered patient without saying a word. So let me ask you guys, if someone said prior to your hospital, say, for $20, you will have a safer experience, would you trade a $20 for a better outcome?
Definitely.
Oh, yeah.
Definitely.
Absolutely. Wow. Oh, that was a late wow, huh? Well, thank you guys. I'm glad that you all stuck around to play everyone's favorite game.
Shocking news from around the world.
Thank you, Pam, for playing the game with us today. We appreciate having you here.
Okay, thank you. Can I come up now and have peach pie?
Come on, Pam.
As long as you bring your ice cream.
Okay. We'll have
You got
to do that
two and a half hour drive, Pam. Come on.
Oh, I'll make it. Won't take long.
All right.
Okay.
Thanks, Pam.
Thank you again, too.
All right. Well, that was fun and enlightening. And don't go anywhere. There's so much more you can learn about healthcare and hospital safety on America's favorite and perhaps only patient safety radio show, Speak Up and Stay Alive Radio. As a hospital patient or family member, wouldn't it be helpful to share your compliments, complaints, or concerns in real time? And providers, wouldn't you like an alternative method to the old, lengthy, and after-the-fact patient surveys? With the patient angle offered by Benchmarking Group International, patients and providers can enjoy a secure, cloud-based, cost-effective, and scalable technology software solution that offers real-time delivery of actionable feedback and alerts to management and staff. See it for yourself and request a complimentary, no-obligation 30-minute demonstration. Visit benchgroupint, I-N-T, benchgroupint.com or call 703-688-2860. If you're a patient, tell your doctor or hospital about this sensible way to improve the patient experience. Visit benchgroupint, that's benchgroupint.com, or call 703-688-2860. Well, there you have it, another tightly packed show just for you. And if you missed any of it, or you would like to share with someone who needs to hear it, simply head over to the website speakupandstayalive.com. Speakupandstayalive.com, all spelled out, and visit the archive page. All of the previous programs are housed there, and you can listen again at your leisure. And if you would like to spend some one-on-one time with me, invite me to speak to your group, your club, association, church, or hospital. I speak to both the patient and the provider perspective. Call me to discuss how we can make your next event different, fun, and informative. 440-725-5462. That's 440-725-5462. Well, out of time once again, but be sure to come back next week. I promise to have more goodies to share with you. Same time, same place, but you know me, never the same information. Until then, I hope you have a healthy and a happy week, free from misdiagnosis and shrinking brain cells. I am Pat Rouleau, and I am your guide to safe and successful healthcare and hospital encounters.
Listen to Pat Rouleau and Speak Up and Stay Alive RadiOh. Stay safe from little-known healthcare and hospital hazards. To learn more, go to speakupandstayalive.com. That's speakupandstayalive.com.
Hello? My name is Joe. Is this Pat Rouleau, the host of Speak Up and Stay Alive RadiOh?
Why, yes, it is.
Who are you?
Who am I? I am you. I am every person who has ever been in a hospital or doctor's office and has received less than acceptable treatment.
Who are you?
I am you, the person who got an infection during a simple outpatient procedure.
Wait, who are you?
I am you, the patient whose questions are ignored, who struggles to speak to the doctor as he or she has one foot out the door. I am the missed heart attack, the hospital-acquired infection, the wrong diagnosis, the unanswered call button.
Oh, so you're all about me. Do you have a quick tip to help me stay safe?
Take care of yourself by paying attention to infection opportunities. Where are they lurking? Waiting room magazines, TV remotes, elevator buttons, doorknobs, restrooms. The opportunity to acquire an infection in the hospital is huge. Germs and bacteria are everywhere. They float in the air, live on your clothes and hands, and reside on everything in sight. The consequences of a hospital-acquired infection are grave. Yet, prevention is simple. Be a germaphobe. Be a clean freak. And Joe, wash your hands often and remind others to wash theirs before touching you.
Listen to Pat Rouleau and Speak Up and Stay Alive RadiOh. Stay safe from little-known healthcare and hospital hazards. To learn more, go to speakupandstayalive.com. That's speakupandstayalive.com.